New treatment for internal hemorrhoids called Rafaelo. The technology been used for long time now. It's been used for the laser vein therapy for the varicose veins, and now been modified to used for the hemorrhoids as well. The most common are first and second degree for the Rafaelo hemorrhoids, which can be performed at the outpatient settings. The third degree hemorrhoids also could be addressed, but I think they're slightly bit more pronounced and require majority of cases general anesthetics. The experience in the third degree hemorrhoid will be shared with us by my colleague Mr. Marzuk, which has performed several operations for the third degree. I've done majority of the patients for the first and second degree of the hemorrhoids under local anesthetic or bit of sedation in outpatient settings, and very few for the third degree under general anesthesia. So what is the Rafaelo procedure? It's a radiofrequency ablation of the hemorrhoids under local anesthetic. The probe produces a radiofrequency thermal injury to the cushion of the hemorrhoids to cut off the blood supply to the hemorrhoid. It's an outpatient setting procedure. It doesn't take very long. We inject a bit of local anesthetic once patient is in the room. Then we apply the probe into the hemorrhoidal cushion, apply the thermal application of the radio frequency via probe. And when we see the hemorrhoids are shriveling down and changing in the color, then we withdraw the probe and cool down the area with the cold Seton. Normal patient just get out from the couch and walk out of the room with the minimal discomfort, and we provide the painkillers to take home. That's for the first and second degree of hemorrhoids. That's the anoscope and the radiofrequency probe, which goes into the cushion of the hemorrhoids, which you can see on the left-hand side of the screen. And then on the right-hand side, you can see slightly whitish tissue after the ablation of the hemorrhoid once the probe has been removed. And then we wait for the final stage of the treatment, which takes place in the next few days. This is the device which is producing radiofrequency and the probe next to it. And this is step-by-step Rafaelo procedure explained what I just said. Anoscope into the back passage, then the local anesthetic on the picture number 2, which shows that the local anesthetic is injected underneath the hemorrhoidal cushion and above the muscle layers of the rectum, just to avoid any additional pain and injury to the muscle. Then the probe is inserted into the cushion itself, lifted off the anal wall, and the frequency ablation is applied. It doesn't take long. The temperature of the frequency ablation is around 100 and 120 degrees of Celsius. It lasts for a few seconds, and then we apply cold Seton to cool down that area. The ablation is applied in several places of the cushion, depending on the size of the cushion, but we start from the top of the hemorrhoids, and then we work our way down towards the lowest part of the hemorrhoid. All of this has to be applied above the dental line of the anal canal. That treatment does not affect the skin component, can be applied in 2 sites or 3 at most at any one time. Excellent results from the long-term follow-up. The recurrence rate is calculated between 12 to 18%. And the recurrence normally is on the other side than the treated side of the hemorrhoids. As you can imagine, the hemorrhoids are in 12 places in your anal canal. So if we treat 2 or 3 of them, you may develop hemorrhoids on another side of the anal canal if you don't change your lifestyle, if you still do constipation or heavy lifting or strenuous activities.